Hello, everyone.
How y'all doing?
We're so glad to be back.
Yes, we are Stethoscope Diaries, and we're bringing another episode to you all on preconception visits and preconception counseling.
Yes, I'm Dr. Franklin.
I'm Dr. Coates. It's so nice to see you all. I want to start this off, sis. Before you have 2 children,
Yes.
did you ever have a preconception visit?
I'm pretty sure I did.
Okay. I like this.
Yes.
I did not.
Oh, God.
I was not prepared for my, so preconception visit was not something that I had, but I think this is why this conversation is important for us to have today. So because you've had one, what would you describe a preconception visit as?
Well, so I was a medical student at the time. So I was real in tune. Like my pregnancy had to be planned.
Yes.
We could not just not plan it.
Right.
So preconception visit, basically going in, talking about your general health and figuring out where the pitfalls are.
Right.
And future pregnancy that
Absolutely.
may pose some complications down the road.
Yes. And for those of you who don't know, the preconception visit is before pregnancy. You are planning what life could look like during your pregnancy period. So making sure that we have all the things in place before that time period comes. And so sometimes that can happen at a regular visit, like your annual care visit, you know? So for me, I have some women who see me currently, and it may not be a technical preconception visit, but it's their annual visit, and they're saying, hey, Dr. Coates, I'm wanting to see you because I am thinking about getting pregnant. And I still counsel them on expectations and things like that moving forward. And if they have some high risk factors, then I may schedule them for a separate visit.
Yeah, because it's not part of the big conversation a lot.
Correct.
You know, we talk a lot about pregnancy that's already in place, planning the postpartum period and just getting through pregnancy, but having conversations about planning a pregnancy and actually timing your cycles and timing when you want to give birth.
Yes.
Some people are doing that. We just don't have that conversation a lot. And so it's up to us. Sometimes we're adding in preconception counseling and you don't even know.
You don't even know what's
that
happening.
you need it. You don't even know it's happening. We're just, finding ways to keep you healthy. And we know people of reproductive age, they're going to probably get pregnant at some point. So it's a common concern and topic on our head.
Absolutely. So other things, I think it's important to kind of talk about what will happen during some preconception counseling or at a preconception visit. So the first thing that I am always doing is the basics. What medical problems do you have?
Yes.
Right? How many pregnancies have you had, if any? What were any outcomes of that pregnancy? Did you end up in a C-section? Was it a vaginal delivery? Was there any bleeding? I try to get your full scope of history, obstetric history, your gynecologic history. Do you have a history of polycystic ovarian syndrome? That could affect your risk.
Absolutely.
And then also your other comorbidities, such as our other medical problems, such as blood pressure.
Yes, high blood pressure, diabetes. Those are always going to impact your pregnancy and whether or not you're at risk of delivering preterm, whether your risk of miscarriage is increased too. And one of the most common risk factors for having a complication in pregnancy is having had that complication before.
Absolutely.
So your history is so important. Whether you are seeing your OBGYN that you've been seeing with your previous pregnancies or you're meeting a new doctor, these are all things that need to be talked about in depth.
And I tell people there's no detail that is too much.
Right.
So if there's something that happened in your pregnancy and you're like, I don't know, it was probably small, let us know because it could be something that could affect us moving forward.
Absolutely.
Yeah.
And it helps the conversation move forward. When I have someone who gives me some information, I'm just like, gosh, that does not make sense. I love investigation.
I do.
I love the investigation.
I be like a detective. I'm like, so they it'll be like something like, they said something was wrong with my blood cells. I'm like, well, what happened?
Right.
You know,
I
like
love
trying to
putting the
get into
pieces
it.
of the puzzle together.
Yes.
I'm like a detective.
I know. And then I'll finally say the term and they're like, that's what it was. I'm like, look at us.
I know. I'm so smart.
Same way.
No.
I love it. I'm the exact same way. I think also surgery is important too.
Absolutely.
Yes.
Oh my gosh.
Yes.
There are some surgeries that are going to limit your ability to have a vaginal birth.
That's important. A lot of women don't know that or they forget it. So, for example, one of the most common surgeries that women can have before they even attempt to get pregnant is a myomectomy, which is a procedure where we remove fibroids from your uterus. And that procedure, how it is performed and how extensive it was, could affect your risk of having a vaginal delivery. So some women will forget about it because they may have had it years ago or when they were younger.
Yes.
And I'm like, no, it's important to bring that to the table so that we can request things like your operative report. We can review it so that we can talk to you about your risks.
One of the most common ways that I find out if something is going to be an issue is I say, did your doctor ever tell you never to have a vaginal delivery? Or did they tell you there is something specific you have to remember for this next pregnancy?
Yes, yes. I think that that is a good point to make because I think women forget about it because they're so excited about this next chapter. So I agree. Absolutely. Yeah. I think other comorbidities are medical problems that could affect pregnancy in the future, or just general things like liver disease history of kidney disease. I think a lot of women forget to tell us about those as their obstetric providers because it could affect how we counsel them in their first moving forward in pregnancy. For example, certain medications that they could take because it could put them at higher risk for high blood pressure in pregnancy. So those are also important conditions that we need to know about.
Right.
What's up, y'all? I am so excited for you all to be watching our channel. Don't forget to like as well as subscribe. All right, let's get back to this episode.
Okay, so back to the topic of past medical history or past obstetric history. It's so important because, like we said, if you've had a complication in the past, you're at risk of having it again. And there's so many complications that can happen in pregnancy. So you want to be prepared.
Correct.
And you want your doctor to be prepared.
Yes.
So back to, say, for instance, how many pregnancies have you had? I think that's important.
It is.
You've had how many pregnancies? What was the outcome, which you mentioned already? Were they miscarriages? Were they in the first trimester? Were they second trimester, which is a whole new pathway of lab testing and possible treatment with blood thinners?
Correct. Exactly. And I think also like checking for other conditions that could have led to that. So that's why the miscarriage history is important, as well as history of preeclampsia is important because there is some laboratory assessments that we could do early on before getting pregnant so that we can help, one, to reduce your risk of having any miscarriages or to make sure that your prior health conditions did not leave a long-lasting effect on the organs. For example, sometimes your preeclampsia or high blood pressure can affect things such as your liver or your kidneys. So we can do laboratory assessment to check for those things early on.
Right. So with high blood pressure, we know that there are lots of other conditions that come along with that. Kidney disease. And I know that we talked about preeclampsia. You mentioned that. I said high blood pressure. They are synonymous.
Yes.
High blood pressure and pregnancy. If you are not educated, not certain about that topic, we have an episode that you can watch.
Go check it out. Yes. I like how you plug that in.
Exactly. Another condition that we can see in pregnancy is diabetes.
Yes.
So gestational diabetes is, of course, blood sugar that's not well controlled. And that can happen in pregnancy. And once you are no longer pregnant, then you have to have a test because it can linger even beyond the pregnancy.
Correct. Yep. So it puts you at risk for having that, what we call type 2 diabetes, which is diabetes outside of pregnancy. So by having these conversations early on with your doctor, we can assess for that early just so that we can prepare for pregnancy, so that we can be on a medication that is appropriate for you to take prior to getting pregnant if that's needed.
Yes. Another condition, postpartum hemorrhage.
Yes.
That's a big one.
Yes.
Because that can happen in people that have had it before, so you can prepare ahead of time. But sometimes it comes unexpectedly.
I agree.
And you have to be prepared. You have to make sure you're keeping your blood count up before pregnancy, because guess what? Your baby needs to make red blood cells and they steal your iron.
Yes.
So those little rascals
Right.
will steal your iron. And you can become more anemic if you start pregnancy already anemic.
I agree.
That's one of the main things that I focus on at preconception visits is what's your blood count? What are your labs looking like now?
Yes.
What's your weight? What's your baseline so we can kind of get you to the point where when the pregnancy comes, you're already at your
we're
best
healthy.
point.
Yeah, we're at a healthy starting place. I agree. I think a lot of times, a lot of patients forget that sometimes we're a starting place, right? By having the conversation saying, I want to get pregnant, I had these medical conditions, we may start a testing that could lead to you may needing to see a specialist, a subspecialist, to look further into that condition. For example, if you have issues with anemia and being able to keep normal amount of red blood cells, that could prompt further evaluation with another physician, like a hematologist, which focuses specifically on blood cell disorders. And so by coming to us initially, it not only allows you to gather information, but it also gets you to the next place for further assessment and even more diagnosis if that's needed. So I definitely agree. Yep.
So when you have your preconception visit and you're talking about your history, we're doing labs, we're trying to figure out, do you have medical problems? Some people already come in with medical problems.
They do.
So one of the most important things we do is also review their medication list.
Yes.
And it can be long. It can have a lot of medications on there that is not safe for pregnancy. And so that is also critical because if you are on those medications, you're not taking contraception, you really need to be seeing your OBGYN regularly, having the conversations on, preventing pregnancy. If I do get pregnant, what are the potential risks of the pregnancy if I'm not protecting myself from pregnancy on these medications?
Yeah. I think so. Two of the most common ones that I see, you tell me if you see anything differently. The first one is medications for your blood pressure. So we do have some young women who are attempting pregnancy and they're on a medication that can affect their fetus or their growing pregnancy. So we have to switch things over. So that is one that we obviously have to talk about. Another big one is your medications that you may take for any psychiatric conditions that you may have. And a lot of people stop their medications completely because they're concerned about the safety profile. But coming to a physician, having a conversation with them, and choosing your family medicine doctor or your internal medicine doctor, and as well as your OBGYN, those are great places to start, just so that we can get you on the safest medicine as you're transitioning into your early pregnancy. And so those are the two big ones. There obviously are very many out there that we need to talk to you about that you cannot take in pregnancy. And so I think this is a good place to start.
Absolutely. I think that you are so right. Those two types of medical problems are the two types of medications we're constantly jungling around, trying to figure out what's safe in pregnancy. And you mentioned that stopping cold turkey.
Yes.
That is not safe
It's
for
not
everyone.
safe. No.
It is not.
No.
If you have bipolar disorder or major depression, and that is keeping you healthy and stable and able to take care of your family and able to go to work every day, and all of a sudden you start your medication and you can't do those basic functions and you are at risk or in danger, then that is something that we don't advise. We advise you to come in and speak with us immediately.
Of course, yes. I think that is the biggest one because every woman is trying to do what's safe for their baby, and I get it, but I always remind them our mental capacity, our psychiatric conditions, that's what allows us to continue to be safe so that we can show up as our best self. So
absolutely.
Yeah.
I would say another medication, although we don't see it as much anymore, seizure medications. I mean, there are some women that are on medications for seizure disorder that can actually impact the development of your baby's spine.
Yep.
So that's really important medication. If you're on medications, you just need to have that check-in every year.
Yeah, I agree.
Hey family, we love spending time with you all. We love bringing you all content. Please tell us what you want to hear. Put it in our chat, talk to us, follow, subscribe, so we can start bringing you content that you all are really interested in. All right, so as far as family history, some additional things I'm always thinking about is if there's a family member that has a developmental delay. Developmental delays can be associated with so many different conditions like autism or even Down syndrome, which you want to know about. in families if that occurs. But the other thing people don't think about is Fragile X. That can actually be associated with developmental delay. So that's a condition that we can actually test for before pregnancy,
Yes.
and we can test in pregnancy. Cystic fibrosis is another condition that's recessive. You have to have a trait from each parent, but that does result in chronic lung, pancreas, digestion problems in babies, and they have developmental issues in growth and development, not developmental emotional delay.
Yeah. And I think that's important for us to know because that could affect your route of pregnancy. And we could send you to a fertility specialist to talk about that. There's different ways that a parent may choose to avoid certain medical conditions that can be fatal. And so that is why these conversations are important to have early on. All right. Those conversations are not always just with us either.
No way.
Yeah. So sometimes those conversations are with a maternal fetal medicine specialist or a high risk obstetrics doctor. So we can often refer you to a subspecialist so you can start to have those conversations with them and get further genetics counseling if that is needed. And that is a good place for us to continue to be educated as you're making your pregnancy plan.
Absolutely. The other thing is that, it's important that if you are going to have one of those high risk consultations, it's important for your partner to come.
Yes.
Or whoever else is going to be your support person during that pregnancy so that everybody's on board. Everybody's going to be committed to this pregnancy and making sure that the woman stays safe.
Yeah. And those conversations can sometimes happen in the comfort of your own homes. So it makes it easier for that family member or that support person to be there. So sometimes these conversations are via telehealth. So you can make a telehealth appointment with someone like your obstetrician and gynecologist or the high risk obstetrics doctor. So that is an easy way to be able to continue that care.
Right.
Yeah.
So if the woman is not there for our annual exam, where we kind of incorporate other things in that visit, what else do we need to do during this visit?
Yeah. Well, sometimes we do an exam, like an overall physical exam. That is not always something that we do. Often women we see is someone we seen for an annual care exam a couple months ago. And so then that doesn't mean you have to get something like a pelvic exam. But sometimes that can be like a heart and lung exam. That can be an abdominal exam so that we can assess for prior surgical scars or incisions. And then sometimes that can be a pelvic exam, but that's not always necessary at your preconception visit. As you can see, we do a lot of history and information taking and education. So a lot of your exam can just be talking.
That's right.
And that's okay.
That takes up a lot of
Yeah.
the time. The other thing that is going to be needed probably is baseline medical laboratory being done. And sometimes the labs will include kind of the labs you get when you see your primary care physician. So you might get your kidney function or your electrolytes or your hemoglobin level, which is your blood count. But also you're going to get maybe some of your pregnancy laboratories
Yes.
that you would get when you're pregnant. I like to get those ahead of time.
Yeah. So things that we look for is your infectious labs, because if we have any infections, we can treat them. We can also look and see if you're immune to certain vaccines, because then if not, we can educate you to get those vaccines before pregnancy. So as you can see, these preconception visits, it is comprehensive and it's a way to educate you, to prepare you so that you can have the safest and most healthy delivery as possible.
Absolutely. And we are just so happy about being here, spending time with you all. Please like, share, subscribe. We want to bring you more content.
Yep. We will see y'all next time. Bye.